Welcome back, everybody, to another Medvarsity Deep Dive.
It's great to be here.
We're going to be talking about diffuse alveolar hemorrhage.
DAH.
Yeah,
Oh,
or as the cool kids call it, DAH.
right.
So this is something that...
Yeah, this is a really serious condition.
Yeah, it's a serious one.
And we really need to...
When I was doing research for this one,
Yeah.
it's like, oh, wow, this is...
Yeah, this can be really life-threatening.
Yeah, it can be really bad.
Yeah.
So I'm really glad that we have you here to kind of walk us through.
Yeah, absolutely.
What are some of the best treatment options?
Well, so I think the first thing to note is that the mainstays of treatment are corticosteroids and immunosuppressive agents.
Okay.
And, while recombinant activated human factor 7 is being studied,
Okay.
these are still considered to be the most reliable options.
Okay, so corticosteroids and immunosuppressive agents.
Correct.
Got it.
One of the...
And those two things are kind of working together.
Yeah, they work together
Got it.
to basically calm that inflammation. And like you said...
Kind of rein in that immune system that's attacking the lungs.
So would that be something like pulse therapy?
Yeah, so pulse therapy is a good example of how we would use that.
Okay, so explain that a little bit.
Sure. So pulse therapy is basically where we give a high dose of methylprednisolone.
Okay.
And that's usually given for about 4 to 5 days.
Okay.
And then we gradually taper it off
Okay.
as the patient stabilizes.
So it's kind of like almost like a...
It's like
a really hard hit right at the beginning.
Yeah, like a big hammer.
And then you slowly kind of...
Yeah, and then you kind of ease off.
Back off.
Yeah, exactly.
Like that.
The initial dosage
Yeah.
can vary,
Okay.
depending on how certain the diagnosis is.
Right.
So if we're really sure it's DAH,
Uh-huh.
we might start with a higher dose.
Right.
But if we're not quite sure,
Play it a little bit safer.
yeah, we might start a little bit lower and kind of see how they respond.
Got it.
But yeah, it's so not a cookie cutter
No, not at all.
kind of situation.
No, it's very much tailored to the individual patient.
So is it pretty much always like a team of specialists?
Yeah, it often involves a team.
Like you're not going to have just one doctor.
Right. It's not just one person.
Who's dealing with it?
Yeah. Yeah, exactly.
Okay, so who are some of the people that are on that team?
So you might have a hematologist,
Okay.
an intensivist,
Okay.
a pulmonologist, even potentially a heart specialist sometimes.
Really?
Yeah, depending on the situation.
Wow.
So it really does take a village sometimes
Yeah, it sounds like it.
to manage these patients.
Okay, so we've got corticosteroids, and then you said
Immunosuppressive agents.
immunosuppressive agents are also part of the
Right.
kind of first line of defense.
Right. So there are a number of different immunosuppressive agents that we use.
Okay.
Some of the common ones include cyclophosphamide,
Okay.
azathioprine,
Uh-huh.
methotrexate,
Okay.
mycophenolate mofetil,
Okay.
and rituximab. And these are all...
Like a whole laundry list.
Yeah, it's a long list.
Of options.
And each of them has its own unique mechanism of action.
Right.
And its own potential side effects.
Right, so it's not like
Right.
they all do the same thing, just
Right.
different names.
They all work a little bit differently.
Got it.
And so the choice of which one to use really depends on the individual patient.
It depends on the patient and probably the severity,
Exactly.
how it's presenting.
Exactly.
Okay, so then I also saw that plasmapheresis is something.
Yeah, so plasmapheresis is another tool that we have in our arsenal.
And this one sounds pretty intense.
It can be intense.
Yeah.
But it's a really effective treatment.
Okay.
Especially in cases where the immune system is really driving the disease.
Okay.
So, for example, in Goodpasture syndrome,
Okay.
where you have antibodies attacking both the lungs and the kidneys,
Mm-hmm.
plasmapheresis can be really helpful.
So in that case, it's not just the bleeding, but it's like an actual immune system
Right. It's an autoimmune process.
attack. So plasmapheresis, how does that actually work?
So basically, it's like a filtering process.
Okay.
Where we remove the harmful antibodies from the blood.
So it's like you're taking the bad stuff.
Exactly. You're taking out the bad guys.
Got it.
And that gives the body a chance to kind of reset and start healing.
So how do they decide if someone needs plasmapheresis or not?
So one of the key factors is the level of immune complexes
Okay.
in the blood at the time of diagnosis.
Okay, what does that mean?
So immune complexes are basically
Is that like...
clumps of antibodies
Okay.
that are kind of on a rampage.
Got it.
And so if those levels are really high, that tells us that the immune system is really
going after it.
really attacking aggressively.
Got it.
And so in those cases, plasmapheresis is often
More crucial.
more crucial. Yeah.
So the higher the level of immune complexes,
Right.
the more likely they are to do plasmapheresis.
Exactly.
Got it. Okay, so we kind of have all these different factors. So how do they actually go about like figuring out the severity of it and how that's going to affect the treatment plan?
So I like to think of DAH treatment as kind of a boxing match.
Okay.
You've got 2 phases.
Okay.
You've got the initial phase, which is focused on achieving remission.
Okay.
So that's like knocking the disease down.
Got it.
And then you've got the maintenance phase,
Right.
which is focused on keeping it down for the count.
Okay.
Yeah.
So how do you decide like what the game plan is for each of those phases?
So to guide these decisions, we often use what's called the EUVAS score.
Okay.
And this is a scoring system that classifies DAH into different levels of severity.
Okay.
So you have limited DAH, early generalized DAH,
Okay.
active generalized DAH, severe DAH, and refractory DAH.
Wow. So there's like
Yeah, there's a whole spectrum.
a whole range of how bad this thing could be.
Exactly.
So what is that UVA score? Is that based on blood work or?
So it takes into account a number of different factors. It looks at things like
Okay.
how much bleeding is there?
Okay.
What are the patient's symptoms?
Uh-huh.
Are there other organs involved?
Okay.
So it's really a comprehensive assessment.
That makes sense because you would need to know all that to kind of tailor your treatment.
Exactly.
Wow.
You need to know how sick the patient is
Yeah.
in order to know how aggressive you need to be with treatment.
So that score, is that kind of the end all be all, or do you kind of also take into account individual variations?
So it's a helpful tool,
Okay.
but it's not perfect.
Okay.
So we always have to use our clinical judgment
Right.
and take into account the individual patient.
Because everyone's a little bit different.
Exactly.
Their bodies are going to react a little bit differently.
Right. Every patient is unique.
Okay. So you use that score, but you also kind of use your gut and your knowledge of the patient.
Exactly.
Got it.
It's a combination of art and science.
So we talked about the remission phase. We talked about the maintenance phase.
Right.
What are some of the therapies that would be used in the maintenance phase?
So typically after we've achieved remission with a stronger immunosuppressant like cyclophosphamide,
Okay.
we'll transition the patient to a less intensive immunosuppressant
Okay.
for maintenance therapy.
Okay.
So some of the common options for maintenance therapy include azathioprine methotrexate or mycophenolate mofetil.
Got it.
And again, the choice of which one to use
Yeah.
depends on the individual patient and their specific situation. While we've made great strides in DAH treatment,
Yeah,
there's still a lot of work to be done.
for sure.
And so, one of the things I'm really excited about
Yeah.
is the potential for personalized medicine.
What does that mean for DAH?
So for DAH, this would mean being able to tailor treatments to the individual patient
Okay.
based on their unique genetic makeup and the specific triggers that are driving their disease.
Okay, so kind of like getting away from that one size fits all.
Exactly. Moving away from the one-size-fits-all approach.
Yeah.
And towards more targeted therapies.
So that's something that's like kind of a pie in the sky idea, or is that something that's...
It's definitely still in the early stages,
Okay.
but it's something that I think is very achievable.
Okay.
And with the advances in genetic testing and data analysis,
Yeah,
I think we're going to see a lot of progress
that's cool.
in this area in the coming years.
So what are researchers working on right now that could potentially change how we treat this?
So one of the areas that's really exciting is the development of drugs
Okay.
that can specifically block the harmful immune responses
Right.
that are driving certain types of DAH.
Got it. So instead of just suppressing the entire immune system, you can
Exactly.
we can target on that specific
pathways
that what are
causing the problem.
That's really cool.
Yeah, it's very exciting.
And that would help cut down on side effects too, right?
Absolutely. That's one of the main goals.
Yeah.
Is to reduce side effects.
And are there any other promising areas of research for DAH?
Yeah. So another area that's really interesting
Uh-huh.
is looking at novel delivery systems
Okay.
for existing medications.
What does that mean?
So basically this means finding ways to deliver the drugs
Okay.
more effectively
Okay.
and with fewer side effects.
Got it. So it's not necessarily a new drug. It's like a new way to
Right. It's a new way to
get it into
get the drug where it needs to go.
Exactly.
Exactly.
Yeah.
And so there are a lot of different approaches being explored.
Okay.
Things like nanoparticles,
Uh-huh.
different types of injections.
Yeah.
So it's really
Molecular development.
active area of research.
So it seems like even though this is a serious condition, there is a lot of hope for the future.
Absolutely.
treatment.
There's a lot of hope.
And people are really working hard to
People are working very hard
improve
to find better treatments.
the lives of patients who are dealing with this.
Exactly. And that's what keeps me going.
Yeah.
You know, knowing that.
It must be really rewarding
It is. It's very rewarding.
to be on the cutting edge of
Yeah.
research.
It's a privilege to be able to do this work.
Yeah.
For sure. Yeah. Okay, so we've talked about the future of treatment. We've talked about diagnosis.
Right.
What can our listener do if they or someone they know has been affected by DAH?
Well, I think the first thing is to not panic.
Yeah.
DAH is a serious condition,
Yeah.
but it is treatable.
Okay.
And so, if you or someone you know is experiencing symptoms,
Right.
it's important to seek medical attention right away.
Okay.
The earlier we catch it,
Yeah.
the better the chances of a positive outcome.
The better the chances of a positive outcome.
And, there are also some great resources available
Okay.
for patients and families.
Like what?
So there are a number of organizations
Okay.
that provide information, support groups,
Okay.
and advocacy for patients with DAH.
That's great. So no one has to feel like they're going through this alone.
Exactly. There's a whole community of people out there who understand what you're going through
It makes a big difference.
and can offer support.
Yeah, it really does.
Yeah.
Okay, so as we wrap up our deep dive into DAH,
Yeah.
is there any final thought-provoking question or insight you'd like to leave our listener with?
One of the things that I think a lot about
Yeah.
is the possibility of preventing DAH
Okay.
altogether.
So even better than treatment is.
Exactly. Wouldn't it be amazing
Yeah.
if we could identify people who are at risk
Yeah.
before they even develop the disease?
So what would that look like?
Well, it might involve things like genetic testing
Oh.
or identifying specific environmental triggers
Uh-huh.
that increase the risk of DAH.
And then you could kind of intervene early. Exactly. And then we could potentially intervene early
Maybe even prevent it in some cases.
and hopefully prevent the disease from developing in the first place.
That would be incredible.
It'd be a game changer.
Yeah, that would be a total game changer.
Yeah. And so, that's really what I'm hoping for
Uh-huh.
in the future.
Yeah. Well, that's a great
That's my dream.
goal to have.
Yeah.
So, to our listener,
Yeah.
thank you for joining us on this deep dive into DAH.
It's been a pleasure.
It was really great to have you here
Thanks for having me.
and learn more about this condition. And hopefully, we provided some hope for the future
I hope so.
of treatment.
Yeah, me too.
It really is incredible to think about, what the future could hold
It is.
for DAH.
Yeah.
And, just thinking about all the people out there who are affected by this.
Yeah, absolutely.
And to know that there's so much work being done
Mm-hmm.
to try to improve their lives
Yeah.
is really inspiring.
Yeah, it's a very hopeful time.
Yeah.
I
For
know.
DAH research.
Yes. Yeah.
So to our listener out there,
Mhm.
thank you for joining us on this deep dive into diffuse alveolar hemorrhage.
It's been a pleasure being here.
Yeah, thank you so much for sharing your expertise with us.
Of course, anytime.
We learned a lot today.
Good. I'm glad.
And hopefully our listener did too.
Yeah, I hope so too.
So until next time, keep learning, keep exploring,
Keep asking questions.
keep advocating for yourself or your loved ones.
That's right.
And never underestimate the power of knowledge
Well said.
and a well-informed patient.
Absolutely.